Welcome to Media Advocacy as a Tool for Narrative Change. My name is Casey Deems, and I'll be running this Dialogue for Health web forum with my colleague, Jeff Bornstein. We would like to thank our partner for today's event, the Berkeley Media Studies Group. Now it's time to meet the moderator of today's event, Karya Lustig. Karya is the director of the Program Office CDC Cooperative Agreement and the Deputy Director of the PHI Center for Health Leadership and Impact, which runs the Leadership Academy for the Public's Health. Welcome, Karya.
Thank you, Casey. So welcome, everybody. Thank you for joining us today. So the bulk, if you can go to the next slide. So our agenda today, the bulk of the time is going to be with Berkeley Media Studies Group. We're really excited to have them here today to talk about media advocacy as a tool for narrative change, something that should be really useful in today's climate and is a great skill set. So they have a lot to offer us today. We're hoping to have time at the end for question and answer. So please use the Q&A panel that Casey just mentioned throughout the webinar to type in your questions. I'll be moderating, kind of reviewing those so that we're ready for the Q&A portion. I'll pull some out and we'll be able to field those questions back to them for any that we're unable to answer live during the event. Next slide. So I'm pleased to welcome our two speakers. We have Shadai Martinez, who's the head of training for Berkeley Media Studies Group. She leads trainings where she supports advocates in enhancing the media and communication strategies to advance their policy goals. She previously worked at Mission Neighborhood Health Center in San Francisco in HIV services as the director there of services, and has worked in various direct service and managerial positions at the Mission Neighborhood Health Center. So welcome, Shadai. And Chinyere Amobi is from the Berkeley Media Studies Group as well. She's their strategic communications specialist. She helps community advocates better frame and communicate their health policy goals. And she previously served as the community editor of Center for Health Journalism. So welcome to both of you. We're excited to hear the presentation today.
So at this point, we would just ask you to share in the chat your name and pronouns and a few words about what narrative change means to you, especially in regards to public health. Even though we have a short amount of time and we won't be able to engage as closely as we would like, but feel free to be submitting questions in the chat, and we'd love to just learn a tiny bit about you with this question right now. So as Casey mentioned, today we will be talking about media advocacy as a tool for narrative change. And I see you're jumping into the chat. Awesome. So I am Chinyere Amobi, Strategic Communications Specialist at Berkeley Media Studies Group, and I'll pass it to Shadai to briefly introduce herself.
Hi, thank you, Kyra, for the introduction, and this is Shadai.
So a little bit more about what we do here at the Berkeley Media Studies Group. We're a program of the Public Health Institute, and we work at the intersection of public health, media, and social justice. So we do that in three ways. One is researching on news coverage of public health issues. So better understanding how public issues are currently being talked about in the media and tapping into the pulse of the kind of conversation and narratives already swirling around public health issues. Also, media advocacy trainings and strategic consultation for community groups and public health advocates. So similar to this training, we tailor them to the different groups and health departments that we're working with to best help them to meet their media advocacy goals. We also work on the other side of the equation, providing professional education for journalists to help them have more of a public health perspective in their reporting. So our objectives for today are to understand how an overall strategy can help align your narrative change work with your advocacy. So we'll talk about what an overall strategy looks like and how it can help you to be really strategic about your messaging, but also the organizing side. We'll also discuss how to align your message with your solution. So really talking about how to make the bulk of your messaging focus on your solution and what change you actually want to bring about with your advocacy. We'll also talk about how to articulate values in your messaging. This is often something that's missing in messaging in public health, talking about why you care about the issue, why your target that has the power to bring about the change should care about the issue, but also why the media and the public might care as well. We'll also talk about identifying proactive and reactive media tactics to get your message out. So not only thinking on the reactive side and having to put out those spot fires, but also thinking about how to proactively get your perspective out there. And I'll pass it on to Shadai.
So we wanted to start with, and thank you for your answers. I've been reading them, and we'll address some of the things that you've mentioned there. So that's really helpful. And we want to do another. We like to do trainings interactive. We know we have a limited amount of time, so we'll use what we have. So we'll do a mental exercise, and this is just to think about what would someone know about your public health issue if they only get information from the news, and also what would they not know. And whether you're working on lead poisoning prevention efforts, whether you're working on COVID, whether you're working on housing or childhood immunization, whatever the work that is that you're doing, what would a average person who only gets information about it from the news know or not know? We start these conversations in our trainings to hear what is the starting point for people? What is the current public narrative about the issue that you're working on? And what we usually hear in our trainings is that there's no nuance, that the issues that they're working on are presented in a very overly simplified way, that there are no solutions, and which means often the work that you're doing is invisible or nobody knows about the work that you're doing to solve these issues. And also that it's focused on very extreme cases. We see that, for example, with domestic violence coverage, where we only see when there has been a fatality or like a celebrity case, and we don't see the nuance and the variety of instances of domestic violence. We also hear that sometimes that's not in the news, and that your issue is just not presented in the news. And that has implications, because the way that the news present issues shape how people understand those issues. And for a lot of people who don't have lived experience, who don't experience the issue that you're working on, the news might be the only source of information about this. And so we like to do this like little mental exercise for you also to step out of your expertise, or for us to step out of our expertise in public health, because we want to be able to meet people where they are and understand what their narrative, what their understanding is on the issue. And we focus on the news because we know that the news has a very important function in our society. Some of the things that the news does is the news set the agenda. So whatever's on the news is what we all are collectively thinking about, talking about with friends or acquaintances. And so it tells us what's worthy of our attention, and by omission, what is not worthy of our attention. The news also shape the narrative, how it covers the news, who speaks, who doesn't speak, what details, what context, and if any, what solutions are presented. The news also reaches decision makers. And we as advocates, as public health advocates, we have an interest in reaching those decision makers, because they are the ones who have the power to implement some of the solutions that we want to see implemented, especially as we are trying to improve our surroundings, and we're trying to improve population health. We want to be able to reach those decision makers and tell them what to do. And at the same time, we will be able to shape the narrative by elevating the solutions and the values and the voices that are typically left out of the conversation. So media advocacy, the way that we approach media advocacy and the way that we understand media advocacy is that it's the strategic use of mass media to support community organizing to advance social or public policy initiative. And the keywords here are strategic, because we know we have limited time of resources and energy. We want you all to use the media in a strategic way so that it best supports your efforts, and that it again supports, because we don't want to just go to the media just to go to media sake. We want to be able to tie it and align it with your goals and the changes that you're seeking to change. And we turn to media advocacy because we think, we in public health, we think that education is not enough. It's good and it is important, but it's not enough. And in this, we're talking about narrative today, and in this country, we have a strong narrative, and that is that education is all people need, and that we just need to tell them the information, and they'll make the changes in their lives and do the right thing. And this picture right here it's a little bit challenging that narrative. And the story that this picture is telling us can be nuanced and it can be layered. So at some level, for some people, This story is about nutrition and disease, and the choices that we need to do is about freedom of choice. For us at public health, it's also an example of how education can compete with an environment with public health stories, or with public health people are wagging our fingers at people, and where the food industry is promising a story of happiness. So those are some of the things that this image is telling us. And the deeper narrative in this story, it's behind the billboards. And that is, these are in a neighborhood in Oakland, California. These are in somebody's building where they live. This is where kids live, and kids who can't be shielded from the industry and the marketing that is targeting their communities, no matter what their parents do. So for us, this is a story that should make us angry about the inequities in our society, and who gets to decide whether these billboards are on the side of your house or not. So that's why we turn to media advocacy, because we know that in public health we don't have the resources that a multi-billion industry has to promote these. To promote their products. So we use the news. We use the news to create the changes that we want to create at the large level, at the policy level, so that a large group of people are impacted. So I want to talk about the difference between media advocacy and social marketing, because I think most people are familiar with social marketing and often gets confused. And so social marketing is using marketing tactics to sell or to promote a healthy behavior. So it's focused on individual focus, it's focused on giving information, warning, informing, aimed at personal change, so individual behavior change. It's a very top-down message. This is what you need to do. And it's, again, aiming to close that information gap. If people know what they do, then we just need to tell them, and then they'll do it. And in media advocacy, what we're seeking to do is not just focus on individuals, but focusing on issues, and using the media to pressure those decision makers with the power to create the change that we want to create. And mobilize those potential allies, those supporters, those people who are with us, to put more pressure on those decision makers. The goal here is policy change or systems change, and is really, instead of just a top-down message, is to give people a voice so that we can say what needs to happen in change in our communities and close that power gap. So how do we engage in media advocacy? I'll pass it back to Chinere.
So the layers of strategy is a tool that BMSG has used for decades to help advocates be very strategic about that media advocacy that Shadai was just talking about. And in the case of this webinar, the layers can also help advocates be more organized and strategic about aligning their advocacy with their narrative change goals. So for the purposes of this webinar, we'll be focusing on the overall strategy and the message strategy, but I want to just give you a brief overview of each of the layers. So with the overall strategy, this is where you get very specific about what is the problem you want to address, what is the solution that you're advocating for, that very specific solution, who has the target to bring about that change that you want to see, who are the allies that can help you amplify your message and reach your target, and what are the tactics that you're going to use to get to the media, but also to get to your target. Your media strategy involves thinking about what is the best communication channel to actually reach that target. So we use the term media loosely here. It's essentially just thinking, what is the best communication channel? You might find that it is not best to go first to the media to reach your target. It might be best to go one-on-one or to a public hearing. So really thinking about what's the best way to reach your target. Your message strategy is going to involve what you actually say about your issue. We'll get into framing in the next couple of slides, but really thinking about how you talk about your issue, how you frame that problem and solution, how you talk about values, but also who are your messengers that'll best reach your target. And the access strategy is determining when media could best influence the policy process or best influence your target to move on your solution. So we're going to show now an example of an overall strategy from a the Vallejo Housing Coalition, which is an organization in Solano County that BMSG worked with in 2020. And this is based on their work on an eviction moratorium package at the county level during the pandemic. So they defined their problem as evictions during COVID-19. So I want to point out here that they were very specific in the problem and how they defined it. They could have just said housing issues during COVID-19, but that's a very big problem to tackle. And so they thought about what was it feasible for them to actually tackle at this time. And so they specified it down to evictions during COVID-19. Their solution was county eviction protection. So that's what they'd be advocating for. And immediately you see that close tie between the problem and the solution. Their issue is evictions, and so their solution is protections to protect residents from those evictions. Their target that they determined would have the power to enact those protections was the County Board of Supervisors. So this is going to impact, now they know who they're talking to. So that's going to impact how they frame their problem in their messaging, but also it's going to impact what methods they use and where they put their messaging. They're now funneling their efforts towards this very specific target. And we want to point out that it's tempting to have the public be your target because with public health, we're often geared towards education, as Shadai said. But when you want to be really strategic about your messaging, but also about your resources and your advocacy, you do want to keep in mind who has the power to actually bring about the change you want to see. So they determined this very specific target. Their allies that could help amplify their message were grassroots groups. In this case, it was faith organizations, community orgs, housing orgs, legal organizations. So these are people that helps to amplify their message. And their actions to reach their target, although they did use the media, they pitched stories and they published op-eds or pitched op-eds, but they also mobilized their allies through social media to sign petitions, to submit comments during hearings. So it's a good example of where they didn't just think to go to the media immediately, they thought of other ways to utilize their allies and think of other communication channels to reach their target. And so once you've established your overall strategy, one way to shape the public narrative around your issue is to think about framing, how you frame your issue, how you talk about it. So at this point, I would like you in the chat to write what you think is under this orange bar. What do you see under the orange bar? And you could write it right in the chat. All right, Jamie's first. Seeing consensus on prevention works. And here's what's actually under the bar. Did anyone see that coming? Did anyone guess this assortment of letters? Yeah, wow, indeed. So what happened and why is this relevant to our conversation? So cognitive framing refers to the connections that are, I like the emojis. Cognitive framing refers to the connections that our minds immediately make based on just a few clues from the environment. The reason that you could see prevention works, even though that's not what it actually said, is because of framing. You got a couple of clues, and in this case, it was like the tops of the letters, and your minds did the work. I think you all just called us public health nerds. Essentially, yes. Yeah, you've probably seen prevention works many times. You've seen each of these words. And so it's a good example of how your mind just makes these like split-second connections. So we do this exercise to highlight that nobody comes to these public health issues that you're working on with a blank slate. Everybody has their views, their beliefs, their values that they bring to any issue that they encounter. And these are influenced by their experiences. And so is your audience is going to be bringing these existing frames as well. And so is the public through the media. So we talk about framing to emphasize that we want you to be as specific as possible when talking about your issue, because you want to leave as little wiggle room as possible for the audience to bring in their own existing frames to fill in the holes, with their existing frames. So the key here is to be as clear as possible when you're talking about your issue. And this is especially important because public health issues are often framed in a very specific way, which influences how we view the problem, but also where we place blame for problems. And that's important because if we want to talk about these policy level solutions, we need to be able to talk about the problem in such a way that leads to these policy level solutions. So based on our research on public health issues, there's a very specific frame that the media in particular brings to these issues, and that is the portrait frame. So with the portrait frame, we often have a very compelling story, and we learn a lot about an individual or an individual instance. And these portrait stories often place a lot of responsibility for the problem and the solution on the individual. So if the individual is successful, it's because of their personal hard work, or they pull themselves up by the bootstraps, that sort of thing. If they fail, it's because of their own personal failings. So this involves stories about how people can lose weight or make healthy food choices without taking into consideration the environment within which they're able to make these decisions. So with this image, you just see a child who's about to make a decision, but you don't get any context. And that's kind of exemplary of the portrait frame. So what we want to move towards is landscape framing, where you get more information about the systems and the structures around individuals that can connect individual instances to trends and themes. So in the case of this image, now we see that the child is not just making a decision without context. You see, for instance, the advertising that's pushing the child to buy cookies, or you see what's actually available to the child. There's water, but there's also apple juice, there's orange juice, there's sports drinks. So with the landscape, you really widen the conversation to think about those structures and policies that are in place that influence the environments in which we make our health decisions. So when we tell a story in the landscape perspective, we're able to actually include those environments and structures. And thus, when we propose those policy level solutions, they now make sense and seem like the appropriate solution for the problem and how we framed it. So as much as possible, we want to move from this kind of individual level framing that places the blame on the individual and open it up to that landscape side that places the blame on the environments, the policies, the decision makers that allow these environments to exist. So that landscape framing is especially important when we talk about equity. So for instance, when you say people who live in a neighborhood X are 3 times as likely to have diabetes, a lot of people in the general public, but also decision makers, they hear people living in neighborhood X have made bad choices. Why don't they eat better? So when we have that absence of the landscape in our narratives around our public health issues, we run the risk of blaming communities for the health disparities that they're experiencing. So when you provide that kind of landscape context, you open up the conversation to allow for policy level solutions that place the blame in the right area. Now I will pass it off to Shadai.
And these frames are triggering very specific narratives and values and set of principles of how we understand the world. And under the portrait frame, there is this narrative around personal responsibility. You know, you're on your own, you do this to yourself, to your family, the market will solve all of our problems. And we really don't need government interference. And we know that there's been a very strong narrative that's been pushed by anti-tax movement to shrink government, right? And so in contrast, we have the landscape. And in the landscape, it's evoking the principle of shared responsibility and values of unity and interconnectedness, which is really what We're in This Together is talking about. So that we do have a collective responsibility towards each other, and that we want to see social justice, and that when we all have the resources that we need to live happy, healthy lives. And that's why we need government, and we need government to do their job, to do what they need to do to protect us. And you can think about government or think about the fire department. You know, I can't, if my house is on fire, I can't put it out by myself. I need to call the fire department. And that's what, you know, government is and should do, is how we pull our resources together to do for each other what we can do alone. And that's what we want to evoke in our messages, that especially when we are calling out government for not doing what they should be doing. And that's why we have protect, or should protect, so that we are constantly checking in on government, on how they're doing and how they're implementing the solutions that we know are going to have an impact on a larger population level. So why narrative change, and how does this relate to what we're talking about? There are many definitions out there, and it's very interesting to see what you wrote. And I think a lot of what you wrote is resonating with this in the chat, in which we want to shift away from blaming individuals and personal responsibility towards our social shared responsibility. The way that we understand narrative is that it is a set of stories, foundational stories that tell that we use to make sense of the world. And these are stories about how things work, our history, who and what matters, and what is our relationship to one another and to the planet. And it matters because the stories we tell about social and health issues are going to have implications on the solutions that people think are possible. So I want to show a couple of examples of what we mean by that. So in the story of childhood obesity, we have two contrasting narratives here. One is you are what you eat, and the other one is what surrounds us shapes us. And this mirrors that portrait and landscape framing that we talked about. So the stories that we hear is like, it's about poor parents who are not looking out for what their children are eating, or it's about bad habits and personal bad choices, overactive thumbs and underactive legs, and how much video games are keeping kids inside. And it's, again, the parents who are not sending the kids outside, and that's exercise and exercise about. Okay, so this is what there's some of the stories that feed into that narrative of you are what you eat. And on the other hand, we have what surrounds us shapes us. And some of the stories that we can tell under that narrative is that there is a multi-billion industry targeting communities of color with junk food and advertising, or that our neighborhoods connection and safety, and whether we have access to transit or parks and green space in our neighborhoods is going to help us go out and exercise, or that schools keep cutting down on physical activity, or that there are local, state, federal policy that can improve those conditions for people, whether it's soda taxes, whether it's monitoring advertising and limiting advertising, or whether it's zoning about junk food or other restaurants. So, this is just examples of the different stories that we can tell under these two narratives. And I have another example that we want to talk about, and this is about housing. And again, we see the same thing in a portrait and a landscape set of narratives. So a man's home is his castle. My responsibility is to my house, my family, not yours. You didn't pay rent, that's on you. If you can't afford it, move somewhere else. And displaying the inevitable is the market, and that's just how things work. And in contrast, again, the different sets of stories that we could tell about housing is that strong roots make healthy communities, that stable housing enables solid and longstanding community connections, that in our diverse communities, people are safe and protected, and that there's things that local government can do in planning and in preventing displacement and gentrification. Again, these are just two examples of how the portrait and the landscape frames shape narratives around health issues, and what we need to emphasize and do to shift that narrative. So we can go to the next slide, Chinyere. Like Chinyere said earlier, there are no blank slates. There is a strong personal responsibility frame that is the dominant frame, and that's where people go to immediately, just like you did when you typed in prevention work in the chat. People go to immediately to the personal responsibility, and it is our jobs as advocates to shift the balance and to bring it back to the landscape and to kind of have that balance a little bit more. And shifting this narrative is going to be hard because it permeates everything in our culture. And so when we are advocating, we need to be very intentional of how we are crafting our stories and our messages so that they reflect and they reinforce that landscape, and we don't inadvertently continue to reinforce that portrait personal responsibility frame.
So now that we've discussed overall strategy and the concept of framing, the message strategy and the messages you develop are really going to depend on what you decided in those stages, what goals you set with your overall strategy and what frames you've now thought about. So as we discussed, it's important to be really strategic about that framing because this is going to impact what solutions actually seem possible. So your message involves essentially what you say about your issue, what you're going to say that'll actually move your target towards the solution that you want. And we're going to get into the components of a strong message in the next slide. But it's really clearly communicating your problem, your solution, but also the values of why people should care about what you're talking about. Your messenger is essentially who's saying your message, who's going to have that, that power, that influence over your target to bring about the change that you want to see. So this is someone that can clearly communicate your problem and solution, and might even be someone that has a very personal, compelling story, for instance, about your issue, but is able to connect to that landscape frame to bring the narrative to that landscape level and connect to the systems and the policies that you're advocating for or against. And also thinking about your role as a messenger. So as public health professionals, sometimes you might step into that role of messenger and might be leveraging your professional experience or your personal experience with the issue and thinking of how you can be an advocate or can be an ally for other advocates that are already doing that work. So really thinking about who are the best messengers for this particular solution and this particular target that you've selected. And of course, the target is who you want to actually hear the message. So this is thinking strategically about who actually has the power to bring about the change that you want to see. And focusing on your target can help you to really stay strategic in your efforts, in your advocacy, because there's always that temptation to want to just spread awareness, reach the public, or influence change on that individual level. But really thinking about your target and the policy that you're actually trying to see can help you stay focused and be strategic in your messaging. So these are the components of a strong message. For your statement of problem, you want to be as specific as possible when you're defining your problem, because that's going to influence what solutions actually seem possible. So as much as possible, you want to get as specific as possible with your problem. And also when you have an issue defining your problem, you might also work backwards of thinking of what is the solution I'm advocating for, and then looking what specific part of a problem is it solving. For instance, with the Vallejo Housing Coalition, they could have just gone for housing issues, but because they were specifically advocating for eviction protections, they saw that that's the slice of housing issues that they're actually addressing with their solution. And so they were very strategically able to frame their problem as eviction, lack of eviction protections. Your values dimension is essentially why this matters. Why should someone care about the solution that you're talking about? This can involve thinking about why you and your colleagues come to this work, why you care, because that's also often going to reflect why the community cares about this issue, but also why your target cares. We know from research that data and statistics and facts alone are not often enough to move people, and they often won't be enough to move your target. So really thinking about how you can infuse your messages with language such as values such as unity, can-do spirit, pride of place. These are the kind of values that can connect people to your issue, even if they don't have a personal relationship with that issue. And your policy solution is essentially who should do what by when. So thinking about the policy or the solution that you're actually advocating for and giving that a good amount of attention. With public health, we often see a big focus on the problem. We see stats and data and graphs really dissecting the problem, but sometimes the solution falls by the wayside. So we want to emphasize that as much as possible, you want to really give some good space in your messaging to describing what your solution is and what it looks like, why you're advocating for it. And so we have a couple examples that show that these different components, they can be used in any order, and depending on whether you're writing a social media message, an op-ed, or talking points for speaking at a public hearing, you can shrink and expand them based on how much space you have. So this is another example pulled from the Vallejo Housing Coalition. And it says, it is more important than ever during this time of hardship to protect our most vulnerable neighbors from eviction and foreclosure. So right off the bat, you see the values of protecting our most vulnerable neighbors. So there's that protection value, but there's also, when they say our neighbors, emphasizing that community aspect, that interconnectedness. While some tenant protections exist at the state level, there are gaps in who and what is protected. So there you see the problem stated very clearly. There's a lack of protections for tenants. The Vallejo Housing Justice Coalition is working with local tenant attorneys and community organizations to advocate for a temporary emergency countywide eviction moratorium that will fill those gaps. So you see that clear solution and how it directly relates to the problem stated. And then they end with values. These measures will help Solano County put health at the forefront of our COVID-19 response and recovery. By emphasizing that this is Solano County, you have a little bit of that pride of place, kind of like, we can do this, we can put health at the forefront and protect our vulnerable neighbors.
And I would add that these are the values that do reinforce that landscape frame when we're talking about our neighbors, when we're talking about Solano County can do the right thing. It's evoking and is supporting that, that landscape frame that we should act as a society. It's not just blaming individuals for what the experiences that they're having.
Mm-hmm. And this next message also does that emphasis on community and the landscape framing. So this is a social media example from the California Native Vote Project. It says Native youth are doing their part in protecting our most vulnerable, our elders. So right away, we see again protecting our most vulnerable from getting COVID-19. Our youth can do their part to protect leaders by taking safety measures and getting vaccinated. It's important for us to protect our elders because we are their lineage. They are the reason why we're here today. So the values you see here, they reinforce that landscape frame by really speaking to interconnectedness. We need to protect each other. We're in this together. It's also connecting the youth to their elders. So there's that legacy of past and future. You're connecting that individual, what these individual youth need to do to protect the community, protect our lineage. So with COVID-19 rising in some communities, as well as the recent surge of the Delta variant, it's critical that we continue to wear our masks, wash our hands, and stay 6 feet apart. So these are very basic recommendations that we've seen throughout the pandemic, and they're often framed in a way of like, this is how you protect yourself from COVID-19. But here it's a very specific landscape framing of not just protecting yourself, but protecting our elders, protecting our most vulnerable. So really connecting that individual to the community. Oh, you're on mute.
Rookie mistake. So let's talk about the media and where you're going to disseminate these messages. And because we were talking about earlier about how the media can be a powerful way to start shaping the narrative and to insert our narrative, that's why we focus on media advocacy. It matters where you present your messages, but it is important to keep in mind who's going to be listening. So I do want to say that media advocacy will take time and effort and preparation in advance, and it will be only as successful as your preparation and your media engagement practices. So here are some tips to get started with working with the media. We highly recommend folks to track coverage, excuse me, to monitor what stories are being written about your issue, who's writing those stories, whose voices are being included and whose voices are not being included, what kinds of solutions are present, what kind of frames are evoked, and what kind of narratives are inserted in that story, and what are the gaps that you can fill in with your own stories. We also recommend building relationships with reporters so that when you are pitching your story or when you are reaching out for coverage, that you're more likely to get bites from reporters. And some of the things that you can do, very simple, sometimes, depending on how much time you have, but you can just follow them on social media, retweet their articles, or you can reach out to them and tell them they did a good job. You can reach out to them and tell them you want to tell them a little bit more about your work, or provide some background information. And that's about providing resources that when they do reach out to you, you can provide them with fact sheets or provide them with people that they could talk to, if not yourself, and just being a resource for them as well. And then maintaining a media calendar. So maintaining a media calendar can help you stay up to date on what potential opportunities there are in the media that you can be using. So, just thinking about calendar wise, when are some things that are happening or holidays or events that are happening that you can tie your issue to and use it to pitch stories or to pitch an op-ed or to create news around. Or also, what are decision-making timelines that you need to be aware of that you might want to create news right before that happens or right after that happens to support some of the work that's being done. So there are different ways in which you can use a media calendar. It doesn't have to be cumbersome, but it's just going to be a good way for you all to be aware of when there are opportunities for you to insert yourself in the conversation. Our media strategy involves also thinking critically and being, again, strategically about how and when you're going to engage with the media. So we want you all to think about what are the best methods to communicate with your target and whether the media is one of those methods. So it may not be, and maybe that you can have a one-on-one meeting and that's enough. And that's the case with the Solano County example that Chinera was sharing with you all, is what they did is they met with some of those supervisors, and they were able to get some support and buy-in from some of them. And so their media wasn't so much used as a shaming or adding pressure, but it was a little bit more about supporting and showing that there is community support for their decisions. So you're thinking about strategically how media is going to help you advance your goals and help you advance your goals in the long term as well. Also thinking about the media that is going to reach your targets. So sometimes we all might, be interested or wanting to get into the New York Times or getting into the big publications. However, that may or may not be the most effective. And if it's a local media, then that might be able to mobilize local community members and show your targets that there is interest, and then that the community members are paying attention in the decisions that they're making. And lastly, to compile media tactics that you will use. So thinking about how and how much time and energy and resources you have to dedicate to your media efforts. So some of those media tactics can be letters to the editor, for example, and letters to the editor are the most basic and low-hanging fruit in terms of what you can do. Just respond to an article, respond to something that's happening in the world. But you can also have a coordinated effort where you and your allies and coalition members or your organization is submitting letters and in support. And that's another way in which you can continue to insert the narrative after something happens over and over again. Can we go to the next slide, Chinina? And the next one is the editorials and op-eds, and those take a little bit more time, and you have to pitch it and see if the publication wants to publish it. But at the same time, it's really powerful because you can proactively create the narrative that you want to present, and you have a little bit more control over that, and that can be really helpful. Then there's also other things that you all can do, like creating news, and that's just pretty much creating an event or having some sort of activity, releasing a report, or a protest, doing something that is going to attract media attention. You still have to pitch it to reporters, and hopefully if you have good relationships with those reporters, then you might be able to be successful in getting that media attention. Piggybacking on breaking news is about capitalizing on a current story and inserting your solutions. And there's plenty that's going on right now that we've seen advocates galvanizing what's happening in the world and what's happening in this country to advocate for solutions. And so that's just one way to make it local or make it relevant and really push for those solutions. And paid advertisement or paid placements, that's something that, depending on your budgets, you can do in being strategic about it. Which publication is it going to be? Is your target going to read it? And can you place it, in a way that you make sure that they're going to see it? And lastly, what we have in here is that to reuse the news, because like I said earlier, media advocacy is not the strategy. Media advocacy is supporting your strategy, supporting your advocacy, the goals and the work that you are doing. And in the same way, just getting something published is not the end of it. Getting something published is a good thing. And then you want to reuse it. You want to either send it to the target, so make sure that they see it, send it to your allies so that they can disseminate it and share it on social media, keeping those clippings so that you can share with other reporters as you are continuing to build your narrative. So it's not a one-time deal, and it doesn't end with publication, but it is a way to get that narrative out there.
So we know we had to speed through that, but just to summarize, kind of refresh on what we covered today. We talked about how to understand how your issue is currently framed. So how is your issue being talked about right now? What are the narratives that are swirling around about your issue right now? How is it being framed in the media? And how can you use media advocacy to play an active role in framing your issue? We talked about illustrating the landscape, so taking the conversation away from that individual level of personal responsibility and personal blame, and really thinking about the structures and the policies and the decision makers behind the environments in which we're making health happen, and how we can talk about our issues in a way that illustrates that landscape. Articulating values, so really talking about why people should care about the issues, not expecting just facts and figures to move your target and to move any of your secondary targets, but thinking about why should they care? How can you emphasize interconnectedness, community, pride of place to move your target? Also aligning your specific problem with your solution, making sure the two of them fit and that you're talking about your problem in such a way that leads to these landscape level solutions. And also choosing the best media tactics that will best reach your target. So really being strategic in your efforts, and who is your target, and funneling your efforts towards reaching them, whether it's going to the media or it's using other methods or using your allies as well to help to amplify your message. So thank you so much for joining us today, and feel free to reach out to either of us if you have any further questions or wanted to hear more about any of the things that we mentioned today.
And we
Thank
have
you both
time
so much. I think we have time for about 1 or 2 questions. If people want to send in any through the chat, we're happy to field some of those. One thing I was thinking as I was listening is we work with a lot of coalitions or various collaborative groups, and they frequently struggle with that moment where something comes up in the media, some event happens out of the blue, and they struggle to suddenly get it, have that moment of opportunity with the media, and pivoting the difference between the types of messages they might use to attract stakeholders or people that are involved in the effort versus the sudden media opportunity where there's attention on the issue, and sort of how to address that. And I wonder if you have any thoughts in addition to what you've already laid out about sort of how to do that pivot of kind of the collaborative stakeholder type of framing versus the public media side of it in that like sudden moment when something happens.
Yeah, we actually recently had or I guess it's not recent anymore. Time just passes so differently now, but it was in November. We had a reporter panel and they talked about just that, of taking advantage of when your issue is in the news and not using it as just a way to say like, hey, this is our CEO and this is our organization and this is what we're doing, but rather, how do I connect what my organization is doing to what's actually happening in the outside world? And really talking about the landscape. So how do you connect the work that your organization is doing to those greater issues that are playing out right now? So these systemic issues that are happening, these trends in health and in public health, how do you talk about your organization and how do you put them into that story? That's essentially what it is. How do you put them into that narrative that's already going on about your public health issue? So not talking about your organization in a silo of like, oh, this is a press release and here, check out, let's advertise what our organization is doing, but rather this is the work that we do and this is how it fits into how health is happening right now in our society.
And I think we also put in the chat elements of newsworthiness. So whenever folks are pitching stories or trying to get media attention, they have to think about what reporters are looking for. And reporters are going to be interested in what makes news. And so we have a list of some news hooks that folks can use or weave into their pitches so that they are more attractive to a reporter. And so that can be, whether it's an anniversary, it's a breakthrough, it's something related to a celebrity, or, something that is just telling the reporter, this is news, pay attention to this.
Excellent, thank you. And it looks like, I'm just looking through the questions, it looks like people are spinning with good ideas of how they're going to implement or think about the contents. That's excellent. We will be posting the recording as well as all these resources that were sent out on the chat with the recording on the Dialogue for Health sites. And let me just make sure there's not any additional questions here.
I'm seeing here, Karia, about in a very polarized community that has extremely strong viewpoints that are anti-public health, how can you overcome messages that are completely false without creating anger? And we know that these are very, very challenging times. And oftentimes what we recommend folks is to not fall into the trap and start debunking the myths and repeating what the opposition is saying, but really going back and being strong with our messages, being strong with our values, being strong with what we're doing and why we're trying to do it, and especially emphasizing that piece, the why, the how, in the values. And for public health, we know we haven't been very good at saying what we do and how we do it and why it matters. So I think really emphasizing the work that public health is doing and why it's good for the greater good and why it's good for everyone can be a good way to do it. Whether folks are going to be angry or not, that I'm not so sure, but I think it is important for us as we are creating these narratives and we want to push these narratives is to continue to repeat. These narratives take hold by repetition. The more they're heard, the more people are voicing these narratives, the more they will stick in our collective thinking. So we may not win today, but we are here for the long run. So we want to make sure that we continue to bring those stories.
And that goes along with something Lisa Nelson said early on. The portrait frame feels like the American narrative. How can we change something so pervasive and at the root of perceptions of what has built America? And just like Shadai said, it's going to be an ongoing process. It's really, we're working against some really ingrained perspectives in American society. And it's just about staying consistent with these narratives and really over and over again enforcing that landscape frame and emphasizing the function of public health in society, what it actually does, what its active role is in society, and those values of interconnectedness and like linking individual to community. Definitely not saying that it's easy work because like Lisa said, it is really ingrained in American society.
And I'm just going to squeeze one more in. I know
Yeah, it looks like a couple other questions just came in there.
There is a question
more,
about how to effectively emphasize the disproportionate impact of a situation. Oh, I'm sorry, not that one. Oh, I missed it. Without perpetuating stereotypes. And that's a very, very important question because we talk about disparities and we immediately are casting communities of color as being, the ones who are, suffering this or that disease. So what we recommend with that is to always put context when we're putting disparities data out there, that we always say why this happened and name the policies that created these conditions so that we always have some context in which why this is happening and not just like leave it out there, because the portrait responsibility frame is going to kick in and blame the communities that are experiencing those public health harms. All right.
Great. Thank you all so much. Again, all the recordings will be available. If we can go to the next slide. Great. So we have a bunch of upcoming events through Dialogue for Health. We have 2 panel discussions with alumni from some of our programs that work collaboratively in communities. One story is from the field, Partnerships for Achieving Health Equity is tomorrow. And then in July, we have Rocky Times, Why Agile Leadership is Crucial for Impact. We also have an information session for the National Leadership Academy for the Public's Health, which is a sponsor of this, is running an application information session for our new application period opening in August. So that's upcoming as well. Next slide. And applications, again, are opening in August. The link is there, and these slides will be available with that link, which will also, I think, be sent in the chat so that you can get more information about that process coming up for teams around the country working to advance equity in their communities. Next slide. And you can go to our website for more information about this type of work that you might be interested in. And again, the recording and all the resources that were shared on today's webinar will be available on the Dialogue for Health site where you registered for this event. So thank you all for attending, and we hope to see you at another event soon.